Welcome to Adapt and Close. Thank you for joining us. Practice some questions on the lab work. You look at lab work, look at the numbers, but be able to interpret it if it's in the case form. With this new generation, they can give you a bunch of questions and you have to figure out and make sure that you understand. So when you're looking at lab work, just make sure you don't looking at the numbers, but how do I interpret that information when they give me patient condition? What does that mean? If I give you sodium of 125, what do you expect to see in the patient? You think a little bit. Which of the following lab values the nurse, I guess, should anticipate, right? Which lab value does the nurse should anticipate? A 75-year-old nursing home client present to the emergency room. That's all. That's the case. 75-year-old. Age is important. I tell you, there should be something bad going on. What is the problem? Heart rate of 110 and blood pressure of 95 over 50. There's going to be a bunch of buzzwords that I put it together to create this question, right? As you can see, 75 present with this tachycardia and hypotensive. Something should be telling you it's not great. The mucous membrane is dry. Neck vein is flat, right? Confusion and lethargic. Does that sound something that you should be worrying about? These are our buzzwords. Poor skin turgor, right? And capillary refill is greater than 3 seconds. You should be able to put this together and figure out what is wrong with the patient. What do you think? Tachycardia, hypotensive, mucous membrane dry, neck vein is flat, patient is confused, is lethargic, his skin turgor is poor, and a capillary refill is greater than 3 seconds. What do you think is going on with this patient? Dehydration. If I'm dehydrated, what do you expect to see in my lab work? That's all. So, which of the following do you think the patient has? What do you expect? If I'm dehydrated, my BUN should go up. If I'm dehydrated, my hematocrit should go up. If I'm dehydrated, right, what should happen to my urine specific gravity? My urine is going to be dark. You will have some pungent smell. This is all content. You have to bring it together and think critically. Pungent smell. It will be really concentrated. In this specific gravity, 1.002, what do you think? The normal specific gravity is that. This is the highest number of normal, and this is the lowest number of normal. This number is lower of that. Therefore, it cannot be dilute. If it's here, it's diluted. It has to be concentrated. So it has to be greater than 1.030. Therefore, this is wrong. GFR of 40. So this is glomerular filtration rate of 45%. People get confused with creatinine and GFR. GFR, when the normal is high, is good. If the normal is low, is bad. Creatinine, when the normal is high, is bad. And when the normal is low, is bad. GFR 45 is normal. I don't expect this patient GFR to be normal. Creatinine is 1. I don't expect the creatinine to be normal. Critical thinking question using lab value that you already know. And I'm changing it into a question to make you think and apply it in the next generation form of question. So there's only 2 answers there. So that's for that question. The next, note that this may be related to which of the following in a client. And let's draw a CBC on a client and note a WBC of 19,000. That's all. 19,000 from a WBC. What does that mean? That's all I give you. So you have to put it together. You have to know your lab. You know this is an infection. It's not normal. You have to have infection for your white cells to go up. Psoriasis is not an infectious. It's not an infectious problem. It's autoimmune disease, so anti-inflammatory kind of body. Why can't don't go up? So that is a trap. Systemic lupus is the same thing. It's autoimmune disease. It's not an infectious. When you touch them, you're not going to get it. They're not sick from infection. They don't have fever. Kidney disease is not. So when you have abscess, that's an infection. This is pus. That will increase your white count, and your white count can be 19. So test-taking skills, you have to look at the numbers, look at the question. That's why understanding of the question is the most important. If you break down the questions the way you're supposed to, and then you take command of the question, the answer choice is not that. All you care about is what you break down to figure out what the patient has. Number 3. Which of the following need immediate intervention? A client was prescribed for ethacrenic acid for long crackles and pink pseudo buzzwords. Every time I underline a word, I'm underlining a buzzword. Which of the following need immediate intervention? Think about it. 3 words: ethacrenic acid, long crackles, pink pseudo. What intervention do you need? Put the questions together and you figure out the answer, right? Ethacrenic acid is what? This is a loop diuretic. Why do we give the loop diuretic? Patient has crackles and a pink pseudo. These are buzzwords. Put it together. Crackles, pink pseudo. I have what? Pulmonary edema. If I give you loop diuretic, that will help with it. What is the side effect of loop diuretic? You just have to break it on, right? Break it on. Right. Number 1 is hypocalemia. They will be orthostatic. Just don't worry about it. They are sulfur drugs. Okay. So which of these are you worried about? Which of these is more concerning? Dizziness from sitting to standing position. Yeah, that is orthostatic. You got to be sharp. Is that more important than getting exposed to the sun and having a sunburn? This is photosensitivity. Or being important than being tired because they're dehydrated or they have muscle cramps. What do you think? Which of this will you pick if you have to be sharp? Muscle cramp. This is potassium problem. So this need immediate intervention. The others does not need immediate intervention. Same strategy. Which of the following is a priority teaching? Okay, and this is caring for a client with the hemoglobin of 6.9. 2 words, like I said, these questions are short, but for you to think. 6.9 hemoglobin. That means the patient is anemic. Rewrite it, anemia. If you have anemia, what will you tell the patient to do? Take a stool softener, increase their vitamin D, take frequent rest, and drink a lot of water. What do you guys think? If you know the answer, you can put it in your chat. What do you think? Which one is more important? You have to be sharp, okay? They are anemic. Every time they walk, they need oxygen. The hemoglobin is not there. They will be short of breath. They have dyspnea on exertion. Well, which of this is more important teaching you can provide for this patient? Take frequent rest. Okay, so that's your right answer. This question is straightforward. It's just content. A nurse is caring for a client with anorexia nervosa. The client has lost over 10 pounds in 4 weeks. Which of the following will provide information about the nutrition status of the client? Which of this do you think will provide the nutrition status of the client? Content. Anorexia, they lost weight, so they're more nourished. That's all. How would I text if this patient is malnourished? Do I check their potassium, phosphorus, magnesium, and albumin? I put this question to trap you. For patient who is anorexia, as anorexia, potassium is low, phosphorus is low, magnesium is low, albumin is low. But which of these tell you about their nutritional status? First, potassium doesn't tell you that. Neither is phosphorus or magnesium. It's albumin. So that's your right answer. Okay. And this is a question, some people get confused with it. Which of the following laboratory finding is consistent with the current condition? A nurse is caring for a client with what? Graves disease, basically, I can put the disease here, awaiting thyroidectomy. Which of the following laboratory findings is consistent with the current condition? You can try it. Let me see. I will look at the answer choices. So the thyroid, when you have grave disease, you're making too much hormones, right? If you're making too much hormones, your TSH has to respond with that. So there's a negative feedback between TSH and T3 and T4. If this is high, this has to be low. That's all you need. That's a negative feedback. So if the patient has grave disease, I expect TSH to be high and low. It can be normal, right? TSH cannot be high. It's supposed to be low, unless it's a TSH stimulated form. Low TSH and T4, excellent. There's nothing like average TSH. So this is your right answer. Which lab value in the urine analysis is consistent with the anticipated diagnosis? Select or apply. A nurse is caring for a client with acute onset of right flank pain radiating to the groin. No fever, no chills. This is what you have to pay attention to when they give you case study. Whenever you see no, rule out other problem. Client has some nausea. What do you expect when you get urine analysis? Think about it and try the answer choices. What should be your answer? I'll wait for your answer. And the buzzwords I've underlined with you. Acute onset, right flank pain is going to the groin. No fever, no chills, some nausea. When you get a UA, what do you expect? What do you expect when you get a UA? So you can type your answers. Let's see what you think. What do you expect? I don't see any answers there, so I'm going to answer that. Acute onset of right flank pain radiating to the groin, no fever or chills, some nausea. What lab work are you going to expect? You have to make the diagnosis. Like I keep on telling you guys, buzzwords is your friend. This is the umbilicus. Flank pain, it can go here to your groin. Flank pain, it can go into the umbilicus. There's two things. If you go to the umbilicus, it's infection. This is pyelonephritis. If you go to the groin, it's kidney stone. And this is an acute problem. Kidney stone is not infectious. Leukocyte esterase, positive leukocyte esterase is an infection. Nitrate, positive infection. The kidney, when it going through the ureter, it can irritate it and it can cause problem, and there will be blood. It will cause some bleeding because it's irritating the urinary tract system. So they will have some trace blood. Bacteria, there is no infection. Critical thinking question. It requires you to be able to make the diagnosis. I said this question so that you guys can think and learn how to so that your cases will be easy. If you make the diagnosis for this, it's easy. I know this is kidney stone. I'm not going to be trapped by all this. I can't pick all this. This is infection, bacteria infection, large protein. No, it's not going to do that. You can have some infection or glomerulonephritis. The glomerular filtration system is not destroyed. It's just the kidney stone irritating the tract. That's what causes what? Pain is the most important. So the only answer choice is number 3, just blood, trace blood. Just say this question to let you guys think, just blood. And it's all based on being able to figure out the content. And that's why you don't have to memorize. You figure out the thing, use the buzzwords, make the diagnosis and stick with it. And then know, if you know that, oh, kidney stone, I don't have infection. Unless it's been there, it blocked the tube and it's been there for a long time, you develop hydronephrosis, yeah, you have retention of urine and it causes, but it's an acute problem. So only one answer, number 3. This is also classic question. Which of the following lab work or value, I can say value, indicate therapeutic response to the medical management? A diabetic client was seen in the outpatient endocrine clinic. Hemoglobin A1C was drawn to direct therapy. A bunch of words. I'm going to underline diabetic client A1C. So DM, A, hemoglobin A1C. That's all. What level will indicate therapeutic response? That means I'm doing well with the medication. That's all. Which of this tell me I'm doing well with medication and can direct therapy. What do you guys think? What do you think? Which of those will do that? Will tell you they have had therapeutic response with the therapy. That will direct your care. So hemoglobin 10, A1C 10 is too high. 8 is also too high. 2 is more than normal. There's no way if you're diabetic, you're going to be normal. 2 is like perfect. They're always going to be diabetic, but it will be better controlled. So when you see questions like that, if you choose 4, that means you're making the patient normal. It can't be normal. So it has to be number 3. 3 is better controlled, good response. 2 is over normal. We don't want it. These are another lab value. I know a lot of people know this, but they don't know if they ask you questions like that. Can you figure out? So it's a select or apply. Which of the following drug with therapeutic range of 10 to 20 microgram per milliliter the next should include? And then she's teaching new graduate about drug therapy. Which of these has 10 to 20 as its therapeutic range? Do you remember them? Yeah, that's a tricky question. What do you guys think? What do you think? Try your luck. You don't have to pick all of them. There's 5 answer choices there. There can be only 1, 2, 3, 4, 5. Remember your test, they don't, most of the time it's not going to be all of them because then you start guessing. So which one has 10 to 20 therapeutic range? You have to know these numbers because they're very important. These drugs are very, very important. So phenytoin is 10 to 20 level. There's those you can eliminate. There's no way the digoxin and lithium is going to be 10 to 20. That's bad, right? Patient is going to not be happy. They're not going to be happy. The lower is very, very low. Digoxin, the maximum number is like 2, right? Lithium, like 1. Anything greater than 1.5, you worry about it. So you can eliminate those. You can say, this is how, this how. This one, everybody knows. Theophylline is also 10 to 20. But this most people forget about acetaminophen. It's also 10 to 20. So that's its range. So 1, 2, and 4 are your right answer. So if you don't know it, acetaminophen as a range is 10 to 20. It's bad when it's too high. Okay. Few more questions, then we're done. This is another question. You have to be comfortable when you're dealing with NG tube and how to manage. You can use it when you go to your ward and then you're working. You have to be able to know this. At the same time, it's just critical thinking question. Okay. Which of the following lab work the nurse should anticipate or lab value? I keep on using with. A nurse is caring for a client with what? Small bowel obstruction, receiving NG tube decompression for 5 days. That's all I give you. Just write those words. Don't think too much. If you circle or write the buzzwords down, you can connect it together. The question is, what do you anticipate? What is the situation? Somebody has small bowel obstruction. And what are we doing? Yes, NG tube. What are your bars with? These are NG tube, 5 days. So if this is the stomach, I have NG tube here. It's just sucking everything for 5 days into this cancer. What do you expect? I'm breaking the question down. Your stomach is full of acid. So you remove all your acid, right? And the patient is sucking everything out. As soon as you start doing that, there will be electrolyte movement. They will start to move. Which of those you expect after 5 days? What do you think? You select or apply. You don't have to pick everything. But what do you think? You have to know this like code. They can ask you this in pyloric stenosis, dehydration patient, a young kid. I mean, they like this kind of question. Somebody vomiting, the same thing. Somebody diarrhea, the same strategy. You can go into figure out somebody with excessive diarrhea, vomiting, NG2, pyloric stenosis. They can ask you that, and you have to figure out what kind of electrolyte abnormality they're going to have. And as I start talking about it, my stomach has a lot of acid. So if you decompressing, removing all the acid, that means I'm losing. H plus is lost. That is the acid portion. That means my bicarb is increased. So there tell you, if you increase in your bicarb, you have metabolic problem, metabolic alkalosis, right there. So one is metabolic alkalosis. It can be acidosis. This is gone, right? When you're losing whatever in your stomach, it has a lot of sodium in it. So I'm going to have, my sodium is going to be low. As I keep on vomiting, most of the salt, you're losing everything out. So I should not expect, I should expect my sodium to be low. So low sodium. So hyponatremia. Your body will tell the kidney that, hey, I'm losing sodium. So get rid of potassium. Get rid of potassium so that I can absorb more sodium. So your potassium will be low. So hypocalemia. Potassium is not going to be high. I'm losing all my salt, chloride, sodium chloride. Potassium chloride is going to be low, right? And we saw the bicarb is going to increase. So this. So the only answer choice is number one. I intentionally trade it so that you can know metabolic condition that you should expect when somebody has what? NG2. And this is a long one. It's hyponatremic, kalemic, chloric, metabolic alkalosis. Don't forget this. I mean, they like asking. If they ask you question on pyloric stenosis, this is what you expect. Hyponatremic, hypokalemic, hypochloric, metabolic alkalosis. Okay? So the only answer choice is low sodium. This is not going to be low. This is wrong. So only one answer choice, low sodium. Yes, sodium is going to be low. If you see select or apply, it does not mean that you got to pick a lot. Don't worry about it. Just make sure you know the content and use it to answer the question. The same thing. Okay, I'm using the same thing, but I change it. Which of the following fluid the nurse should anticipate? A nurse is caring for a client with small bowel obstruction, receiving NG2 for 3 days. I just said 3 days. BMP reveal what? Sodium of 130. That's all. So hyponatremia, 3 days, and sodium of that. That's all. So I have somebody with sodium of what? 130. And he has NG tube. We already know that their sodium is supposed to be low. So what fluid will you give this patient? Think about it. What fluid would you give this patient? You have to bring your electrolytes, your knowledge of electrolytes, to be able to answer this question. You have to bring your knowledge of electrolyte. If you don't know it, check out Dr. NCLEX. I have a bunch of electrolyte questions. How to think about it. But like I said, don't memorize those numbers. You know, when you go and start working, you'll be thinking clinically. So always think clinically. What can I give this patient whose sodium is low? I always say, go back to the basics. Go back to the basics. Sodium is 130. I cannot give you anything. Okay, is what? What is 130? Is hyponatremia. I cannot give you anything less than 1%. That's all. So whatever I give you, it either I give you 1%, which has a sodium of 145 maximum, because I need to increase your sodium. If I give you anything less than 1%, it's the wrong answer. This is all water. You're going to dilute them, and your sodium will be 125, and you go into seizures, and you get into trouble. This is half normal. Sodium is very low. It's less than 145. And it's less than 1%, so don't give it to them. They still have normal, and then you dilute it with the D5W. Sodium is going to go down. They're going to have seizures, and they will not like you. This is 1%. 0.9 is the same as 1% normal setting. They will be fine. These patients, whenever anybody on NG tube, we put in normal setting. So this patient get a normal setting. Okay, so that patient is going to get normal setting. And the last question. Last question is hard. And I want to see what you guys think. I'm going to read it, then I'll wait until everybody answers it. But this is like a case form you can get in the next generation. So like a case, right? Which of the following the nurse should anticipate to be contributing to the client's symptoms? Bring your content, okay? Bring it, look at everything, connect it together, circle the buzzwords, and figure out the situation and stick with it and say, make your diagnosis and then answer the question. Which of the following the nurse should anticipate to be contribute to the problem? Read it carefully. Age is always a factor. When they give it to you, there's a problem. I have a 45-year-old female, right? Present to the emergency room with what? Abdominal pain, number 1. It has fatigue, number 2. Bowel movement every 3 days, buzzwords. Client was admitted for kidney stone 1 month ago. Recent wrist fracture, so he has a fracture from a minor fall. Recently report of what? Loss of interest in activities. inactivity she enjoy, and sleeps about what? 10 hours a day. She's very anxious. Put all together and see what can you make out of it. 45-year-old, abdominal pain, okay? I have fatigue, right? Constipation. I don't go every other third day. I have kidney stone. Okay, this should be a month. Fracture. It's equivalent to bone pain, right? Loss of interest in activity, sleeping for 10 days. Yeah, I have depression and I have anxiety. Are you figure it out? This is the way you break down case study. You should be able to make a diagnosis from this based on all the buzzwords I've given you. I've highlighted the buzzwords. I wrote them down for you to think about it. I'm just teaching. I'm not in a rush, just to like let you analyze the question. What do you think is contributing the problem? Look at each electrolyte and think about what it does. If it doesn't meet those criteria, you don't pick it. I put 9 answer choices and see if you can bite it and pick more than you need to, and then you get it wrong. You know, I just want you intentionally. Just because I give you 9 answers doesn't mean there's 9 answers there. The story has to match the 9 answers. So, what do you think? There's some lab work that you should be familiar with, right? That when you see it, you know that, oh, this is not what it is. Sodium hyponatremia. If I give you low sodium like that, I'll be talking about seizures, right? There's no seizures yet. This is gone. Number 6 is gone. Potassium, 4.2. It's normal. 3.54 is a little bit low. But when your potassium, okay, follow, if the potassium is low, things start to go low, right? So if your potassium is low, your GI tract will be low. So you have what? A constipation. Yeah. That, do you get kidney stone from constipation and from potassium that is low? No. So this has to go. It has to match. You don't get depression from it. So don't pick one and then worry too much about it. Magnesium of 1.5. Magnesium and calcium. When the level is low, activity goes up. 1.5, I expect activity to go up. So hyperreflexia, things goes up. You know, there won't be fatigue. I'll give you signs of hypomagnesium, which is their symptoms start to go up. These symptoms is going down. Look at it. It's downgoing symptoms. Abdominal pain, fatigue, constipation, kidney stone. It sounds like I'm going down. So magnesium is down. It's wrong. Sodium that is high does not do all this thing. Usually hypervolemia, they dehydrated, signs of dehydration. This does not meet that criteria. Magnesium of 2 is normal. Calcium 8.5 is low normal. So even if it's low, symptoms should go what? Up. What are we left with? Number 7, hypercalcemia. So high calcium. This is what they call, you've heard it before, but you don't know what it look like when they put it in the question. This is what they call it: stone, bone, monstrons, psychiatric manifestation. These are signs and symptoms of hypercalcemia. They have stone, they have mons, right? That means abdominal pain. They have trons, that's the constipation. They have weakness. Okay, they have psychiatric manifestation, depression and anxiety, and they have bone pain. So they can give you questions like that. They can give you a case based on the electrolyte, and they put it together. And there's only one answer choice there. If you pick more than one, you get 0 for this question. So the problem is hypercalcemia. Normal calcium is 8.5 to 10.5. This guy is 12. And he has all the signs and symptoms of that. I do not want to give you the reflex. If I put reflex there, then I give you the weight. But there's only one answer choice there to make the diagnosis to help with that. So hypercalcemia symptoms. This is what the case will look like. How do you manage this patient? Let's do some content, then we'll go. What do you want to do to manage this patient? His calcium is so high. What do you think you need to do? High calcium, right? What is number one? Number one thing you can do for this patient to save them from getting really sick. Number one, high calcium. Calcium is too high. Dilute the calcium. So large amount of fluid. So they get an IV fluid. And flush the kidney with it. You give them furosemide. That is the easiest things you can do. We're not going to go into details, but if there's a question, there's, what do they call it? In the case form, these are two things you can do, you should be looking for. A lot of fluid, and then you give them furosemide to flush things out. After you flush things out, you got to figure out why they have calcium, too much calcium. But it's just flowing, so I would just give you guys, is the bone, this is the bone, and is something coming and chewing the bone that is releasing the calcium? If that is the case, we need to block it. Have you heard about bisphosphonates? If not, check my adaptant class, pharmacology. Bisphosphonate. Bisphosphonate, like alendronate, will prevent the bone from breaking down. So that's another medication you can give them that will prevent bone breaking down. And for this patient, you can give him also phosphorus will help with that. But there's so many ways you can manage that. You can give them phosphorus to interchange with that. But number one is IV fluid and furosemide. Okay. And then if you want to worry about it, calcitonin can also, so if they ask you how to manage this problem, hypercalcemia, let me write it in case somebody doesn't know. Like I said, I don't want to teach. This is just a question, but hypercalcemia management. So you can use, you give them IV fluid, you give them furosemide. Then you give them calcitonin. You give them bisphosphonate. This is like alendronate. They are the one that has the dronate at the end. Okay, you give them some phosphorus to bind it, to exchange it. Okay, quick 12 questions. See you guys later this afternoon, like 2 o'clock-ish. I'll come online again with some few questions. It's a practice run with the YouTube live, but keep charging as always. I hope you get stimulated with these questions. Like I like to set hard questions to let you think so that the board become easy. Any question before I log off?